Dr. Nguyen, tell us a little bit about the difference of, if there is a difference, of a veneer, dental veneer, and a Lumineer. You hear advertising on television, Lumineer. To me, it looks like they're all clip-on fingernails, clip-on tooth nails, I guess. But why don't you tell us what's the difference and which one is used for what?
Okay. Glad that you asked and have a chance to kind of, explain that a little bit. Basically, they are the same thing, like you said, the clip-on or like the fake nail that you glue on. Okay. The only difference is the thickness of the clip-on or the glued on. The Lumineer is very thin and it's made of a little bit of a different type of porcelain than the regular, traditional veneers are made of. But they also have the same purpose,
So why do we use different ones? Is the thin one not so strong, or can you bite into less? Is the veneer, the thick one, better because it's thicker, or what's the deal?
With the Lumineers, you can probably do without having to shave out the teeth. Okay? You can just, because it's very thin, so you can pretty much just glue it right onto what you have right there. Say if you got the tooth that a little smaller or just a little, turn a little bit this way or that way, not completely straight, you can just make a Lumineers, like a few of them, make them all straight and just glue it on. Then you don't have to shave any tooth structure off. So that's the benefit of that.
I see. So you don't need any injections or so because you're not grinding down the tooth?
Not at all.
Right.
Not at all.
But I assume that probably, again, doesn't necessarily always fit because if a person has, a too thick of a tooth already, or if the tooth is a little crooked and with a veneer he wants to straighten it out and not do orthodontic work but actually do, just straighten it, then you need to shave it anyway. I guess then you use the normal veneer.
Yeah, that where you definitely will need to go into a traditional one because you're going to end up having to align the teeth first, basically, like shaving them down, making them, line up right before you put the veneers on. So yeah, in that case, it'll be better if you go with the traditional veneers.
I see. So it looks to me, what you're saying, Dr. Nguyen, is that there are two different brands, or maybe two categories of brands, and for all purpose, the dentist will decide. The patient wants to look good, whatever that is to him. You know what I mean? He wants to get it more white or more this or that, or he wants to get a longer, whatever it is, and the dentist will then kind of decide which one of those two would be overall better for the a patient in order to achieve the job. But they both have the same end effect. Beautiful, gorgeous, $1 million smiles.
Yes, youthful and, they definitely they can change, make the teeth look a lot whiter because with the veneers you can pick out a shade that you like, so that definitely would be the effect.
Good. So it's really the same thing. So the patient shouldn't concern himself too much about it. Of what he gets, because the end effect is the same. They last the same long. They have the same everything. It's just how your teeth are structured. You could sometimes use the thinner one where you don't have to grind, and then the dentist will tell you, look, we can use this thinner one. We don't have to grind, and that's a good thing. The patient will like that. Is there any huge price difference in those two?
Oh, there is. That's I think, in my opinion, that's the only drawback because Lumineer is like a branding. So it's like with brand name, you pay for the brand. You pay a lot more for the brand. So, there is a price difference, a huge one in there too.
I see. So even if a person could put a Lumineer on it because he doesn't have to shave the teeth, the Lumineer would qualify versus the veneer where you have to shave down the teeth. The veneer would then be cheaper than the Lumineer.
Yes, Most of the time it is.
I see. So if money is an option, the person may say, well, I don't really like injection, but because of that no injection way is a little bit more expensive, I go with the injection way.
Well, again, that's a personal choice. But usually I would explain to the patient, look, you value your teeth more, or, you may want to pay a little more to just conserve your teeth, tooth structure, that we don't really have to shave anything or do anything to it, versus, okay, let's just glide it down so we can get, we don't have to pay that much. You see, that's a balance, and
right.
I always make sure that we explain that to the patient very well.
Sure. But in the end, probably doing something to give him the confident smile or whatever it might be is probably always better than doing nothing. Am I right there?
That's absolutely right. That's absolutely right, Helmut.
Good. Well, it's always a pleasure speaking to you, Dr. Nguyen. Have a good evening.